Hi, Dr. Michael Richie. Let's talk about a procedure called a YAG laser capsulotomy. Now the good news is this is something that we only talk about to people who have already had cataract surgery. So let me show you some pictures. Here's the eye with a cataract. Cornea, the cloudy lens is the cataract, there's the retina. When we fix your cataract, we take out the cataract, but we leave the outer shell called the capsule. Well, that capsule forms a perfect little pocket, and we're going to use that pocket to hold the brand new lens. So now, once you've had cataract surgery, this is how your eye looks. The problem is that capsule can cloud over. When it does, it blurs your vision. We fix it with a laser procedure. We use the laser. We're going to make a little opening in the capsule. The opening in the capsule is big enough that you can see through it. It's not so big that it disturbs the implant. Now, it's important to know that the laser doesn't affect the implant at all. So when we do this, technically it's a surgery. The good news is you don't need to see your doctor for a pre-op physical. You're not going to have sedation. There's no IV. That means you can have breakfast, and from your perspective, you can treat this just like you would a clinic visit, even though we do it in the surgery center and technically it's a surgery. So on the day of your treatment, you'll arrive at the surgery center. We dilate the eye. We put in a numbing drop. Now the laser itself is attached to a machine that looks very much like the devices we use in the office. So you sit in a chair, you'll put your chin on the chin rest. We have a little gadget that's going to keep the eye open, keep you from blinking, and magnify. We place that little device right on the eye only during the treatment. The laser is a bright light. It has a snapping sound, anywhere from 10 to 40 laser snaps on average to make the opening, and we're done. Now when we're done, your vision will be blurry all day. We often create some new floaters, so don't be surprised, that's very normal. They typically get better over time. Now, if you have this in the other eye and you need both eyes treated, we'll typically see you back the next week. We'll do the same thing, and then we check you a week or so after that to make sure everything has settled down. It's interesting to note you will not get sedation for this. And if we're treating one eye at a time, technically you're legal to drive, but the reality is your vision will be quite blurry, so we recommend that you have a driver. That, in a nutshell, is YAG Laser